Hi, I'm Jessica, and today I'm going to talk to you about the application of heat and cold therapies as a non-opioid pain management. According to CNN, experts say the United States is in a thirst of an opioid epidemic, as more than 2 million Americans have become dependent or abused prescription pain pills and street drugs. During 2015, there were 52,404 overdose deaths in the United States, including 33,091 that involved an opioid. That's an average of 91 opioid overdose deaths each year. The number of opioid prescriptions dispensed by doctors steadily increased from 112 million prescriptions in 1992 to a peak of 282 million in 2012, according to the market research firm of IMS Health. The number of prescriptions dispensed has since declined, falling to 236 million in 2016. So my teaching plan, my targeted audience would be inpatient progressive care unit patients, typically post-cardiac catheterization patients. I have worked progressive care on and off for 5 years, along with intensive care and ED. These patients tend to have a mixture of chronic and general acute pain, not including chest pain. Post-cardiac catheterization patients sometimes must lay flat in bed for upwards of 6 hours. This becomes uncomfortable, especially if they have chronic back issues already. Other patients tend to complain mainly of beds being uncomfortable or just uncomfortable in general. And they may have arthritic pains or already be dependent on opioid. We try to generally reposition them, offer them Tylenol, NSAID, relaxation techniques, turn on the TV, turn on some music, something to divert their attention away from the pain. Sometimes we'll do gentle massage on the back with lotion to kind of help with the chronic back pain. But I believe that a simple application of heat and cold therapies could help with the pains they experience and cause these pains to become more comfortable for them. So some of my goals of the teaching plan. At the end of my presentation, the patient and family will be able to identify the benefits of heat and cold therapies. They will be able to identify the proper injuries that heat and cold therapies are targeted to help and the time that each therapy should be applied. The patients and families will also be able to identify certain health issues that should not have these therapies. So some of my learning outcomes for heat therapy would be, heat therapy would works by improving circulation and blood flow to a particular area due to increased temperatures. Increasing the temperatures of the affiliated area even slightly can soothe discomfort and increase muscle flexibility. Heat therapy can relax and soothe muscles and heal damaged tissue. So it would be one of my learning outcomes that I want my patients to know. I'd want them to know the time, which is we use heat therapy for muscle pain or stiffness, minor stiffness or tension, and can often be relieved with only 15 to 20 minutes of heat therapy applied. I would want my patients to know that a punctured commercial heat pack should be immediately discarded, as the chemical agents and gels will burn the skin. And then a big key that I would want my patients to know, especially working vascular and cardio, that patients with pre-existing medical conditions such as diabetes, dermatitis, vascular disease, deep vein thrombosis, or multiple sclerosis should not use heat therapy on their skin. Some of my learning objectives or learning outcomes for cold therapy was, cold therapy is also known as cryotherapy. It works by reducing the blood flow to a particular area, which can significantly reduce inflammation and swelling that causes pain, especially around a joint or a tendon. It can temporarily reduce nerve activity, which can also relieve pain. Use of code therapy for short periods of time, several times a day, 10 to 15 minutes is fine, but no more than 20 minutes of code therapy should be used at a time to prevent nerve, tissue, and skin damage. I also would like my patients to know that if a code or ice pack should never be applied to the skin directly, and a barrier such as a towel should be placed between the code agents and the skin surface to prevent skin and nerve damage. And then a big key point that I want my patients to know is that code therapy should never be applied to patients with poor circulation. And I actually was able to teach this to my boyfriend's father, who had swelling of the knee joint. He thinks maybe he tore a ligament working out in the yard, raking leaves. He has a doctor's appointment on Friday, but till then he was having a lot of pain and discomfort, and he doesn't like to take medicine. So I suggested him icing his knee in elevation for several times a day, but only 15 to 20 minutes. And he said that it has been working effectively for him. So that was the kind of good news. So as an evaluation technique, I would want to evaluate my patients by having them repeat back what they had just learned to me in their own words. And then I would want them to demonstrate how to apply these therapies safely and show me how they're going to do it at home if they choose to do so at home. I would reassess their pain level if they're inpatients at hospital after that we apply the therapies for them in about the 15 to 20 minutes to see if their pain has adjusted. And then at home, I would also want them to keep a journal to write their pain level before they apply the therapies and then after they apply the therapies to see how the treatment's working for them over a month period of time and to see the benefits of it and if it's really something that works for them. So my patient handout looks like this. So it's just a simple little handout, something that could be printed off very easily and patients can keep in their chart, stick it on the refrigerator, stick it on their bedside dresser, something that they can keep with them pretty easily. It goes over the application of heat and code therapy. Heat and ice are two of the most common types of passive and non-invasive and non-addictive therapies. Heat and code can be used alternatively and are often used as a prelude to exercise therapy. So it's kind of a little thing that they should be using this with exercise, physical therapy, going to the gym, post-workout. If you go to the gym a lot and your tendons and muscles get sore and stiff, you can isolate in between heat and code therapies. Then I go over how heat therapy actually works with a little picture of heat packs that you can buy from like Walgreens or Walmart. And then I put on here, when should we use heat therapy? We should use heat therapy for muscle pain or stiffness. And then how long we should use heat therapy? We should only use it for 15 to 20 minutes. And then for moderate to severe pain, we can use longer sessions of up to 30 minutes to 2 hours. And those would be like those electric heating pads that, you know, all of us women have probably used before, especially with female issues. Those beanbag things that we stick in the microwave, or a long hot bath, or sitting in a hot tub can be all under heat therapy. We want to caution that heat packs in any form that have been punctured should be thrown away immediately because the gels can burn the skin, or the little pop beads can burn the skin. We also want to condition that people with diabetes, dermatitis, vascular disease, deep vein thrombosis, or multiple sclerosis should not use this because they cannot feel if it's getting too hot for them. They may have neuropathy or not be able to tell if their skin is burning. On the code side, we have what code therapy is, which it is, code therapy is cryotherapy. It works by reducing blood flow to a particular area, which can significantly reduce inflammation and swelling that causes pain, especially around joints or tendons. It can temporarily reduce nerve activity, which can also reduce pain. And then I put, when should we, y'all can see that, when should we use code therapy? We use code therapy for acute injuries or pain along with inflammation and swelling. How long we should use code therapy? 10 to 15 minutes is fine, no more than 20 minutes. Code therapy should be used to prevent nerve or tissue damage. And then I always put my little caution signs. Cold or ice should never be applied directly to the skin, and a barrier should be placed, such as a towel or a washcloth or a little blanket. And then people who should not use it is people with poor circulation, because again, they cannot feel if it's too cold or too hot, and they may accidentally burn their skin or, freeze their skin or do damage, basically is what I'm trying to get to. And then I also put a little star on here to remind my patients to keep a journal, to document pain levels, place a score between 1 to 10, 10 being the most intense pain, before and after therapies to complete, and do this for about a month to see if therapies are truly beneficial. I'm going to try to upload a link of my patient handout so you all can actually see it a little bit better than on my screen, and upload a link of my article that I found on CNN so you all can read a little bit more about this opioid crisis. Thank you all so much for watching.